I would like to thank everybody for joining us today. We are here to talk to newly diagnosed heart failure patients. My name is Ashley Peterson, and today I have with me
Katie Ketchum,
Casey Reno,
and Danielle Strozinski.
Being diagnosed with heart failure can be overwhelming. We are here today to talk to you about what heart failure is, the causes and risk factors, signs and symptoms, and how to manage heart failure through lifestyle modifications and treatment. Let me start off by saying that heart failure is a chronic condition that won't go away, but by understanding what it is and how to manage it, it can be managed. What is heart failure, you ask? Heart failure, also known as congestive heart failure, is a condition in which your heart is unable to generate adequate cardiac output, causing inadequate perfusion of the organs and the tissues of the body. Now let me put that in terms that are more manageable. Heart failure is when your heart isn't pumping efficient enough as it used to be. Your heart has become weaker and it's not able to generate enough force to move all the blood out of the heart after contraction. This leaves extra blood behind. Now let's talk about some of the causes and risk factors associated with heart failure. Heart failure is caused by other health conditions which have weakened or damaged the heart muscle. The main two conditions are uncontrolled high blood pressure and ischemic heart disease, often caused by a previous MI. Any of the following other conditions can also contribute to the development of heart failure. This includes cardiac, coronary artery disease, diabetes, obesity, smoking, and cardiomyopathy, just to name a few. It's important to work with your doctor to not only manage heart failure, but the other conditions that can lead to exacerbation and worsening of heart failure. Now that we know the causes of heart failure, let's take a look at the heart itself. The heart is made up of 4 chambers. You have 2 atriums and 2 ventricles. You have a right and a left side of the heart. So you have an atrium on the top and the ventricles on the bottom. But when you look at the heart, the sides are opposite. So you have a right atrium and a right ventricle, a left atrium and a left ventricle. The blood flows from top to bottom, or atrium to ventricle. The right side of the heart, particularly the right atrium, is where the blood returns back to the heart once it's done circulating through the body. It then flows into the right ventricle and is then pumped into the lungs to be reoxygenated. When it returns to the heart, it returns to the left side of the heart, or the left atrium, which then flows into the left ventricle and is pumped out to the rest of the body. Now that we understand how the blood flows through the heart, let's take a look at a picture to get an idea what happens when someone has heart failure. If you look up here, I have a sponge full of water. This will represent the left ventricle full of blood. When you squeeze the sponge or the heart contracts, most of the water is expelled out. As in the heart, most of the blood is squeezed out of the left ventricle and out to the rest of the body. Now in someone with heart failure, you start with the same sponge full of water, or the left ventricle full of blood, but when you squeeze this sponge, it's much weaker, thus not expelling as much water. In heart failure, the muscle is much weaker and does not create enough force to push out all the blood, leaving the sponge, or the left ventricle, still half full as compared to a normal heart that is almost empty. Due to the blood remaining in the left ventricle, this creates increased force or more work on the heart muscle. Over time, the heart muscle of the left ventricle may become enlarged or hypertrophy. This is to compensate for the extra work on the heart. This makes the left ventricle even smaller, meaning that even less blood will be pumped out. This can also allow the blood to start backing up into the lungs and to become congested, or known as congestive heart failure.
What heart failure actually is, let's talk about the signs and symptoms and how heart failure is diagnosed. There are 3 types of heart failure: left-sided, right-sided, and high-output heart failure. In left-sided ventricular heart failure, there are 2 types, systolic and diastolic. Left-sided ventricular heart failure results from an inadequate left ventricle output and inadequate blood flow to tissues. In systolic heart failure, your ejection fraction is less than 40%. In diastolic heart failure, you have pulmonary congestion despite a normal ejection fraction. Right-sided heart failure results in inadequate right ventricle output and systemic venous congestion, also known as peripheral edema. In high-output heart failure, it is the inability of the heart to adequately supply the blood with blood-borne nutrients. Signs and symptoms of left-sided heart failure, as shown in this image, are shortness of breath, which you may frequently hear the word dyspnea, shortness of breath while lying down, which is also called orthopnea, fatigue, cough with a frothy or bloody sputum, confusion, and a decrease in urine output. Signs and symptoms of right-sided heart failure include swelling, also called edema, of the lower extremities, which is very common in right-sided heart failure patients. You will also see weakness, nausea, fatigue, weight gain, and frequent nighttime urinating. There are 4 classifications for heart failure based on the New York Heart Association's functional classification scale, and it indicates how little or how much activity it takes to become symptomatic. So we ask, how is heart failure diagnosed? It's important to tell your healthcare provider all your medical history, the medications that you are currently taking, and symptoms that you are currently experiencing or have experienced in the past. And diagnosis will be based on your physical examination, symptoms, and tests that will be performed. One popular diagnostic test that will be done in your blood work is called a brain natriuretic peptide, or a BNP. This lab result is extremely elevated in patients that have heart failure, and it's produced and released in response to pressure and increased volumes in the heart's chambers. It's very effective in diagnosing heart failure. The next diagnostic study that will be done is a chest x-ray. In a chest x-ray, it assesses the size of the heart and congestion in the lungs, which is also called pulmonary congestion. The size of the heart, if it's enlarged, it's termed cardiomegaly. And this image here shows a normal-sized heart, and then it ranges with mild cardiomegaly, moderate, and severe cardiomegaly. The next heart failure diagnosis test that will frequently be performed is an echocardiogram. This is an ultrasound test that uses sound waves to examine the heart's structure and motion. Images for this can show the heart muscle thickness and the heart's pumping capability or ejection fraction, which we talked about earlier in systolic versus diastolic heart failure. Also, we will talk about EKGs, which are commonly done. This diagnostic test uses small electrodes that are placed on the chest, arms, and legs, and it records the heart rhythm, frequency of heartbeats, and electrical conduction. Results of an EKG will show a heart attack, an abnormal heart rhythm, and left ventricle thickening.
I'm going to be talking about lifestyle modifications for the management of heart failure. I'm going to start by talking about some diet considerations. These include restricting fluids, lowering sodium and fat from your diet, and limiting alcohol. Restricting fluid is important for the maintenance of heart failure because increased fluid increases the workload of the heart. It is recommended to take 6 to 8 cups of fluid per day unless instructed by your doctor. In some cases, with worsening heart failure, you may be further restricted. The 6 to 8 cups is about 3 to 4 water bottles per day, and keep in mind that food that melts at room temperature counts towards your daily fluid intake. So these include soups, gelatin, ice cream, popsicles, sherbet. Sodium also increases the workload of the heart by increasing fluid retention. So it is important to limit this in your diet. It is recommended that you take less than 1,500 milligrams per day unless instructed by your doctor. Some tips on limiting salt in your diet include reading the food labels. It's really important to do this. For example, this can of soup contains 690 milligrams of sodium per serving. For a person who has a normal diet of 2,400 milligrams of sodium per day, it's about 29% of your daily intake. So for a heart failure patient, that is about that is about 46% of your daily intake. And if you were to consume the entire can, that would be 92% of your sodium for the entire day in one can of soup. So that's why it's important to cook your meals when possible so you know what is being added to it. Seasoning your food with spices can add flavor without adding salt. And it is always preferred to buy fresh vegetables and meats over canned foods because it contains a lot less sodium. So the DASH diet has been shown to lower blood pressure and cholesterol and also promotes weight loss. It is high in fruits and vegetables and low fat, dairy, and meats. And it promotes foods containing magnesium, potassium, calcium, and fiber. It also limits sodium. So this DASH diet, I have a diagram here that shows all the food groups and how many servings per day you should consume. For the nuts and seeds, note that the serving size is per week, not per day, and the fats and sweets should be used sparingly. Because high cholesterol can cause blockage of the arteries and decrease the blood flow to the heart, it increases your risk for stroke and heart attack. So you want to limit foods that are high in saturated fat and cholesterol and avoid trans fats. Trans fats can be found in margarine, shortening, chips, and baked goods. Some tips to limit your fat and cholesterol in your diet: you want to bake, grill, or steam your food instead of adding oil or frying. Choose lean meats like chicken and turkey instead of beef. Use low-fat milk or skim milk, and avoid fast foods. And if you go out to restaurants, choose restaurants that give nutrition facts. Also, cook with healthier oils like olive, canola, or soybean. And if you do use oils, use them sparingly. And again, read food labels to note how many the daily percent. Alcohol should be consumed no more than 1 serving per day. You want to consult your doctor before you do this. It can can worsen your symptoms of heart failure and interfere with your medications. And if it's okayed by your doctor, 1 serving is 4 ounces of wine, 12 ounces of light beer, or 1.5 ounces of liquor. Exercise is important for your heart, but you want to consult your doctor before starting any exercise regimen. If approved by your doctor, you want to start slow and make sure you pace yourself. If you experience any of these symptoms like chest pain, racing heart, shortness of breath, dizziness, weakness, or fatigue, you want to make sure you stop and rest. And if the symptoms continue, you want to seek medical attention. Smoking is very important for managing heart failure. Nicotine increases blood pressure and heart rate, and so quitting is very important. You want to make a plan to quit and stick to it, and avoid personal triggers that increase your urge to smoke. And if you are having difficult time quitting, ask your doctor about medications like Chantix or join a support group. Coping with stress. Stresses also increase it or worsen symptoms by increasing blood pressure and heart rate. So these are some ways that you can help decrease stress, like deep breathing, using visualization, meditation, exercise, and listening to music can also help.
After being diagnosed with heart failure, your doctor will begin developing a treatment plan with you that includes placing you on new medications. These are some examples of some of the new medications you may be placed on. We'll go through those individually and discuss the importance as some key points that you should remember when taking them. So ACE inhibitors are the first medication your doctor may prescribe. These are important because they help to improve blood flow and also to reduce fluid overload or swelling. These medications also help to reduce the symptoms that you might experience. Some of the things to consider when taking these medications include talking with your doctor if you develop a dry, persistent cough. If this type of symptom develops, they may put you on a new medication. It's also important to check with your doctor before taking medications such as ibuprofen or NSAIDs, such as Aleve or Motrin, because these medications can interact differently with the ACE inhibitors. An ARB may be a medication that your doctor may place you on if you develop that dry cough from the ACE inhibitors. These medications tend to work very similarly. They help to prevent your blood vessels from becoming tight and allowing blood to flow more freely, and they also prevent your body from having fluid buildup or swelling. Beta blockers help with multiple different symptoms of heart failure. They help to lower blood pressure and heart rate, and they also help to prevent abnormal heart rhythms. Some of the things to consider when taking these medications include notifying your doctor if you become dizzy. Because these medications lower blood pressure and heart rate, this is a common side effect. Your doctor may just watch it, or they may adjust the dose or put you on a different medication. These medications can also hide the symptoms of hypoglycemia, so it's important that if you are a diabetic that you monitor your blood sugars closely. Diuretics are another medication that your physician may prescribe. These are often referred to as water pills. What these medications do is they help to remove salt and water from your body to decrease the swelling. Some things to keep in mind are that these medications have a side effect of making you use the bathroom a lot. Because you are urinating quite frequently, you may want to take this medication during the day versus at night. And also, with urinating, potassium goes out of your body as well. Potassium is important to your body because it helps to prevent abnormal heart rhythms. So your doctor will more than likely be checking the potassium levels in your lab work. If the levels get to a certain point, they may either place you on potassium supplements or advise you to eat higher potassium foods. Here I've given some examples of some high potassium foods. They include bananas, oranges, strawberries, and raisins. Some key pointers about your medications include taking your medications every day at the same time, using a container that's labeled for each day of the week, so it's just an extra reminder that you have taken all your medications that day. It's important that you never stop taking your medications unless it's okay with your doctor. Talk with your doctor about your medication, especially if you think that it's too expensive and that's the reason that you're trying to not take it. They can kind of work with you so that it's less expensive or put you on something else that your insurance will cover. Also plan ahead for refills so you don't run out, and keep a list of all your medications with you at all times. Managing your symptoms. Some of the things that I like to talk with my patients about are the use of tools, especially when managing your symptoms. Two tools that I like are the heart failure zones and recording what's normal for your body. So I've given some examples here. This is an example of the heart failure zones. As you see here, it goes from green to red, indicating and also indicates what symptoms you're feeling in each of those categories and what action you should take. As you see in green, this means that you're not having any trouble breathing, you're not having any chest pain, and your weight hasn't changed significantly. In the action, you see that you should just continue doing what is being prescribed of you. As you move lower and you look at the orange here, it indicates that you're having more trouble breathing, you're using more pillows, or you're feeling more dizzy than you previously were. At this stage, it's important that you see your doctor right away, so it advises you to call your doctor now. The second tool is one that you should place in your bathroom or in your kitchen, and it just kind of goes over everything that you should check on a daily basis. It goes through your breathing, just asking questions such as, can I breathe as well as I usually can? It also goes through changes in weights. It advises you to weigh yourself on a daily basis after urinating but before eating breakfast. If you notice that you have a weight change of 2 pounds in one night or 3 to 5 pounds in a week or less, then you should call your doctor. You should always check for your swelling. Is it getting worse or is it as it always is? And also, are you having any changes in your ability to do everyday things? At this time, I'd like to thank all of you for watching our video. If you guys have any questions, please feel free to email us and we would gladly answer those for you.